briefly to see some of that as well. Our only opportunity to show you what has been happening over there for the last week under construction. So we wanted to see that while it's empty. Once it's needed, if it's activated at some point, no one would be allowed inside there, obviously, from the outside. So we wanted to get a look at how they're set up and ready to go. We're talking about 4 medical tents, an administrative tent, a pharmacy tent. I believe this is set up in the parking lot at NRG Park. And this is pretty much a county effort with support from others, but they had 57 truckloads of supplies and 70 construction workers out there for the last week or so to get this all built and ready to go as Harris County heads toward its peak. It'll be ready to go starting tomorrow if needed. They are just providing some needed things here for the Harris County judge to be able to be seen and heard as they set up here in a room somewhere over at NRG Park. So this is what communities around the country are doing as they prepare for their own peak in the curve, is to be ready. New York and LA, of course, have those hospital ships for the overflow. Harris County will have medical tents at NRG Park, again with a capacity of 2,000 beds if needed, but they're just starting here with 250 and see where it goes. See if that curve maybe won't be as steep as we expected it to be initially, as everybody practices their social distancing and hopefully keeps this from being as bad as it could be. There have been some encouraging numbers we've seen over the last couple of days nationally as far as the number of potential deaths. Minimum has come from, at least by one model's estimate, from 100,000 down to 60,000 now. This is nationwide, still a very big number, but it's going in the right direction. Everyone can admit that. But for places like Harris County that still haven't seen their peak yet, there's still a big question mark, because we've seen some huge numbers locally in the city, especially of Houston, over the last week with number of new cases. Now that's a reflection somewhat of the more testing that's being done and a lag in testing, waiting sometimes a few weeks or longer to get those test results back. So that's why you see 600 new cases one day and maybe 60 the next, which did happen this week. It has to do with the testing that is coming back, and those numbers are recorded once the testing comes back.
You're so kind. Thank you.
Looks like they have things just about set up here over at NRG. Of course, that is the Harris County Judge Lina Hidalgo. We're expecting to hear from Houston's Mayor Sylvester Turner. I see U.S. Congressman there, Al Green, to our right of the county judge. We'll hear from the county health department, maybe Dr. Pers as well with the city. Let's go now to the Harris County Judge Lina Hidalgo.
Oh, thank you. Yeah. Say that again. Yeah, all right. Thank you all so much. We're, the latest information, of course, this is a fast-moving situation, and so I just want to start very briefly with our update on the cases. Harris County, outside the city of Houston, is announcing 239 cases today and 25 people who have lost their lives to this virus. The case counts will be updated at 4 p.m. yesterday. We were at 3,261, but we'll be adding these new 239 cases as well as any new cases that the city has to report. Since the start of our testing sites, the 2 Harris County sites have done 8,416 tests, and we'll continue building those and doing that along with the City of Houston site. Today, of course, we're here to talk about getting ahead of this. This week, we authorized at Commissioner's Court, unanimously with Commissioners Ellis, Garcia, Raddick, and Cagle, up to $60 million for a medical shelter here at Harris County's NRG Park. Now, I'm proud to have Congressman Green here today. I believe Congresswoman Sheila Jackson-Lee will come by as well. The federal government, FEMA, has committed to reimburse us 75% of the costs, up to $177 million to be able to have this in our community. Right now, what we have is a medical shelter that can serve 250 patients. And what's unique about this is that the shelter is fully set up. It has the equipment, it has the doctors and nurses and the experts and systems we need to be able to respond to an overflow from the hospitals. There are several units. There are 2 units for COVID-positive patients that need hospital care, but in the event that the hospitals are overwhelmed, they would have to come here. There's also a unit for persons under investigations, folks that need hospital care that we believe, that doctors believe have coronavirus, but whose tests haven't come back yet. And then we have a step-down unit that is basically for the folks at an even higher level of care that will be coming down from the hospitals. We're also proud to be partnering with CETRAC, our regional entity, and so they're running a mobile medical unit, and that is a ICU level care for patients that take a downward turn and need to be transferred to an ICU facility at the hospital. We already have the permission to use helicopters, ambulances are lined up, and CETRAC personnel are here. This has been established through a contract with Garner, so I want to thank Mr. Johnson from Garner. Dr. Holland is leading all of the doctors and nurses. We've brought doctors and nurses from around our region. Right now, they're Texans, all of them. They're folks from areas that are not seeing as high instances of coronavirus, and so they've stepped up to come help us here. And these are people who do incredible work as it is, and now are stepping up in the middle of this crisis to come help should it be necessary. I want to thank everyone who's helped build this. The trucks began arriving this past Monday. Today is Saturday, and we have a fully built medical shelter for 250 patients. That is our Harris County Engineering Department, the experts from Garner, law enforcement, Constable Alan Rosen has been supporting that. All of our public health department, Dr. Shaw and his team, so many county stakeholders who've worked with this. Of course, it's a county facility, but this serves our region, City of Houston, other cities. Very proud to be here with Mayor Turner as part of our response together in lockstep. And the way this will work is hospitals, if they reach capacity, they reach their surge capacity, and they still need to they need additional bed space and they don't have it, they will work through the regional entity, CETRAC, and CETRAC will assign patients here. And it doesn't matter whether they're city, whether they're county, unincorporated areas, if they need to be here and CETRAC assigns them, they will come and use that bed. Now, let's hope that we don't need that. Right now, so far, we've invested $11 million in setting up what we have so far. Around $11 million, but as I mentioned, the maximum that Commissioner's Court approved is $60 million at this point. Now, frankly, I had a chance to take a look at the facility earlier. We will be providing tours for elected officials immediately after this as well. And the biggest takeaway for me is it's truly sobering to see this stand up. We are facing, as I said before, very much a war globally. And in a way, this is a Pearl Harbor moment of our generation. We were caught by surprise in this country, but we will not be caught by surprise in this community. Our communities across the country, our local entities, are the shores in this war, are the shores in this battle, and we're fighting it proactively. We don't want to be caught flat-footed. We're working to stay ahead of this, and that's what we're doing. We're setting this up. And look, I wish we didn't have to spend these $11 million. It brings me no joy to have to spend these funds on this instead of on the early childhood education initiative we've been developing, on flood control, on ensuring that we have an adequate public transportation system in this county. But budgets are about priorities, as I've always said, and right now the priority is human life. The priority is avoiding, as to the extent that we possibly can, the fate that other larger counties and larger cities have faced. And so we are doing all we can, and that's why we ask the community to continue to do their part as well by staying home. They help us flatten the curve. With these efforts, we're trying to lift the bar a little bit, and we're trying to make sure that we don't end up in a profound crisis situation. And at the same time, that we get out of this as quickly as possible so we can get back to our lives and get our economy back on track. The last note I'll make is we just got news, Mayor, and I were just discussing that the federal government has reached out to the Texas Department of Emergency Management, who gave our entities a call, that the federal government has now approved for our facilities to do up to 500 tests per site per day. And so that is a doubling of the testing capacity. So far we've been able to do 250 tests per site per day. Now we're going to be able to do 500 in two city facilities, 2 county facilities. We don't know yet when or the details, but they did share that with us, and so I wanted to share it with you all. And I also wanted to just extend a thank you to all our partners at the federal level, and I've been in touch with Senator Cruz about this, Senator Cornyn as well, and a profound gratitude to Governor Abbott as well, who's helped us advocate for the FEMA reimbursement, who's helped us advocate for these tests as well, and we're very much working in lockstep to have this resource for our community. I'm going to repeat my remarks in Spanish, then we'll hear from Mayor Turner, Commissioner Ellis, Commissioner Garcia, and then Congressman Green, who is here as well representing the congressional delegation. En español, brevemente, primero quiero reportar los casos que estamos viendo el día de hoy. Hay 239 casos nuevos, 25 personas quienes han perdido su vida debido a este virus. Ya el número total de casos lo estaremos dando entre la ciudad y el condado. Sobrepasa definitivamente los 3.200 casos y tendremos más datos a las 4. Desde el principio de esta crisis, las dos centros de pruebas, las dos sedes, han llevado a cabo 8.416 pruebas. Hoy en día estamos demostrando un refugio médico, un recurso nuevo para la comunidad. Esta semana pasada la Corte de Comisionados fue unánime en su aprobación de hasta $60 millones para este refugio médico. Los comisionados Ellis, García, Radek y Cagle, todos votaron para aprobar este refugio. Y hemos en este momento invertido $11 millones, alrededor de $11 millones. Quiero agradecer a nuestros socios a nivel federal. Tenemos aquí el congresista Al Green. En el gobierno federal han aprobado un reembolso del 75% de los costos hasta $177 millones. Entonces, este refugio médico puede en este momento recibir 250 pacientes. Y lo que es único de este refugio médico es que hay equipo, hay camas y hay profesionales médicos ya. Entonces, hay enfermeras, doctores de emergencia, todos preparados para responder y recibir a estos pacientes. Tenemos varias unidades, una unidad para pacientes que ya han recibido un diagnóstico positivo de coronavirus, un par de unidades para pacientes o una unidad para pacientes que necesitan estar acá pero no tienen todavía el diagnóstico formal, y finalmente una unidad para pacientes en condición un poco más grave que acaban de llegar del hospital. También hay una unidad móvil, que es básicamente una unidad de cuidados intensivos, y ahí tendremos los pacientes en condición crítica antes de llevarlos de regreso al hospital. Esto es algo para aliviar, si fuera a darse el caso, que los hospitales lleguen a su límite, que hayan ya maximizado su capacidad, sigan al límite y necesiten espacio adicional. estamos listos. Y quiero agradecerles a la entidad regional de CETRAC, ellos son los que estarán coordinando qué pacientes vienen, tienen sus trabajadores aquí también. También agradecerle a la Oficina del Ingeniero del Condado, del Departamento de Salud Pública y la entidad privada que ha construido este refugio médico, ya que todos juntos hemos logrado construirlo. Esperamos no tener que utilizar este recurso, pero lo que hemos visto es que a nivel global estamos luchando una guerra a nivel Pearl Harbor. Nos ha tomado por sorpresa esa guerra, esa batalla, han tomado este país por sorpresa, pero no tomarán esta comunidad por sorpresa. Hemos tenido la oportunidad de planear, de ser proactivos y eso es lo que estamos haciendo el día de hoy. Es planeando para tener esa capacidad médica, para defender a nuestra comunidad contra el virus, para intentar no llegar al nivel de crisis que han visto otras comunidades. De eso depende también que todos sigan ayudándonos a permanecer en casa, no salir. Estamos haciendo estas inversiones para ayudarlos a todos. Y al hacer eso, van a aplanar la curva, nosotros estamos elevando la capacidad. No me enorgullece invertir estos fondos en este recurso. Me gustaría invertir fondos del condado en transporte público, en las iniciativas de educación temprana que estábamos diseñando, en iniciativas de control de inundaciones. Pero como saben, los presupuestos se tratan de prioridades y la prioridad el día de hoy es salvar vidas. Y esto es lo que nos va a permitir hacer el recurso del día de hoy. Entonces, quiero darle las gracias a todas las personas involucradas y concluir con unas buenas noticias. Hemos recibido del gobierno federal que aprobarán el que hagamos tanto la ciudad como el condado hasta 500 pruebas por cada sede de pruebas. Entonces tendremos 500 pruebas por sede en las 4 sedes que hay entre ciudad y condado. Vamos a tener la capacidad de llevar a cabo el doble de pruebas que tenemos ahora. Y una nota de agradecimiento para los senadores, el senador Cruz, el senador Cornyn, que nos ha ayudado a esto, y más que nada también el gobernador, quien ha abogado por nosotros para que el gobierno federal nos dé estos reembolsos. Entonces, con eso concluyo. Voy a invitar a que hable el alcalde, después los comisionados y finalmente el congresista Al Green. Thank you so much, Mayor Turner.
Thanks, Judge, and thanks for your leadership. And certainly, the best way to pass any test is to prepare. And so I want to thank Judge. I want to thank you for your leadership and the Harris County Commissioners, all of them, for the steps that they have taken to put us in the best position to take care of every patient that needs assistance, medical assistance, if we get to that point. So thank you all for being proactive, for setting up the facility that will benefit everyone within our respective region. We know right now we're certainly trying to do everything we can to stay within the capacity of our healthcare delivery system in order to meet the needs of anyone who needs that help. And so right now, when we look at the numbers every single morning, they're staying within their base capacity right now. I haven't gotten to the surge capacity yet, but to the extent they go beyond their base and go beyond their surge, it's good to know right now, not 2 weeks from now, but right now, that Harris County is in the position to take on that excess capacity if needed. So again, let me just say thank you. It's also good news that the feds are giving us the ability to do even more testing. So Congressman Al Green, and on behalf of for the entire congressional delegation, senators and congresspersons, let me thank you and others, because even these dollars that we are talking about, 75, 25, coming from the federal government, so thank you for that. And then the ability to do even more testing, because at this point we were limited to 250 per site in both Houston and Harris County. To go to 500 per site will be meaningful and impactful, because we know in order to get a better sense of the community spread, we need to do more testing. And so it's testing, testing, testing. So that's good news, and I know Dr. Peirce and Dr. Shar will echo that sentiment. But even in addition to the 500 per site, what we're seeking and doing is to go do even more testing beyond the FEMA sites that are set up. And so it's our hope that even in this coming week, that we'll be able to do testing in locations that are closer to many of these vulnerable communities that are needing the help. Communities, for example, represented by people of color, communities where the social economic demographics of those communities are quite low, where there are people suffering from hypertension and diabetes. And so it's our hope that in the next week or so that we can extend testing into like Sunnyside and the East End. So we want to go beyond just the public sites that are set up, and we need to get more into these communities, into these neighborhoods. And Judge and you and I have been talking about that on how to expand testing even beyond those existing sites right now. That will give us a better handle on our situation to be able to trace and isolate and quarantine where needed. Let me just say that as we do more testing, we certainly expect the numbers to rise, so I'm not surprised at all about the numbers rising. The question is whether or not we are able to handle the cases within our existing healthcare capacity, and if need, do we have the excess capacity to do that? And what's being demonstrated and put forth today is that the preparations have been made in order to do just that. But my hope is that it will not be needed. I think that's what we're all hoping, that we never have to utilize the facilities, and which means that everybody has to do their part. I had an opportunity to kind of go around many of the parks in the city of Houston before coming here today, and I'm pleased to say it's like 99% compliance. When you go Memorial Park, for example, it's one of the busiest parks in the country, but when you go to Memorial Park today, it's almost like a ghost town. So people are being compliant. Buffalo Bayou, we had to tell a few people, park's closed, but by and large, 99% compliance. Same thing with Herman Park, and I think as well as the others. So I want to thank people for doing their part, engaging in social distancing, staying at home, and doing everything we can to make sure that we slow the progression. We recognize that we are not at the peak yet, but we want to do everything we can to make sure that when we reach that peak, we're still within our system's ability to handle the patients. I don't have the count for the city of Houston right now. Those numbers have not come in. And of course, as of yesterday, the death toll in the city of Houston was 16. All 16 were related to underlying conditions, all 16. So don't have that number yet, but when we get that number, we'll make it available to you today, and it may come in before this press conference is over. But again, specifically for this moment, Judge, let me thank you, Judge Hidalgo, for your leadership. Let me thank each and every one of the commissioners for stepping out and taking the steps to prepare, to get us in the best position to be prepared to the extent we need it. And on behalf of everybody in the city of Houston who happen to live also in Harris County, a big thank you to each and every one of you. Thank you.
Judge, I too want to thank you for your leadership. And Mayor, thank you. I've said many times there's no playbook for this. I think the two of you, Judge and Mayor, as our public faces of this crisis, you kept calm, you've done a good job, and we applaud you for that. Congressman, thank you for representing the delegation and being here. He and I talk on a regular basis, and my colleague, Commissioner Garcia as well. It is important that this was unanimous, and it was bipartisan support for the county to make this investment. As the judge alluded to earlier, budgets are a statement of our values, and nothing is more important than public health. I was glad to see that the city and county are releasing statistics based on demographics, so we can see, it's early, but we can see if there's certain disparities that are coming out that highlight issues that were there even before this virus came in our midst. So on behalf of Harris County, I want to welcome you to Precinct 1. I notice everyone is social distancing. Everybody has a mask on. I hope you don't end up in this facility, but it was important to make this investment knowing that there is the possibility we may not use it. And for the county to make the commitment, Judge, when you made the call and explained to me, well, we'll be out of pocket for 25% regardless. It was a big investment, but it was the right thing for us to do. So thank you very much. Circle around there. Keep that distance.
Thank you, Judge. And I want to also just applaud your leadership, Mayor Turner. Thank you. And also I want to take a minute to also thank all the other mayors. I've got several in my precinct, and there's several other mayors in various precincts. I want to thank them for their leadership, and I want to applaud you, Judge, for engaging them and keeping them up to speed with all the various things that are happening. It's all fast moving. But another important thing, aside from the vote that was taken, as Commissioner Ellis mentioned, to help stand up this facility, there was another important vote that was taken, and that was to recognize all of our medical professionals, all those in the medical field, our nurses, our technicians. A resolution was passed to applaud and to thank and to appreciate and to respect all of you who are truly on the front line of this pandemic. We want to make sure that you know that those of us in elected office know well on whose shoulders this particular burden is currently on, and we want to thank you. And I also want to thank so many of the citizens. You know, I read my Facebook and Twitter accounts and Instagram accounts, and I just want to thank all the citizens who have made this particular crisis much easier to deal with. It could have been much more complicated, more chaotic, more stressful. But I want to thank the citizens who, as Mayor Turner alluded to, and Judge Hidalgo, that you are heeding the orders by our public health professionals. You are staying home. You are working with your children, reading to them. You're keeping them motivated, even though school is out. I just want to thank the entire community, because this is a pandemic. We are in crisis. This is an unprecedented event. But because the citizens of Harris County have come together, you have made us a true showcase for how to deal with these things when they occur. And so I want to applaud all the citizens. I want to thank all the kids for making life at home tolerable for your parents. And keep doing it. Keep up the good work. Keep reading. I've been reading to kids on my social media pages. I want to encourage the older brothers and sisters to read to your siblings, your younger siblings. Read to them. Take the load off your parents, because there's an incredible amount of stress on their shoulders as well. And you do that, we'll get through this all together. And then lastly, I also want to say that our respective staff, so many of them are here. So many of them are working by our respective sides. They have had to put their family lives on hold. And I just want to say to them, thank you. They have put the citizens of Harris County first. They've put their families to the side for a brief second to help us do our respective work. So to all of the Harris County and city employees and city employees of all the various cities in Harris County, we want to say thank you. We know you are essential, and that you are also a very, very critical part of our success. And then lastly, I also want to say that we are in a religious weekend. Tomorrow will be Easter. However you may pray, however or whatever name you may call your God, we ask you to take a moment that in however you celebrate this weekend, that you keep everyone, the homeless, those who we've had to put wash stations up for, that you keep everyone in your thoughts and prayers. And you do something special on this religious weekend to lift us all up and to make sure that whatever higher being is out there, I call mine Jesus Christ and God, Whoever is out there, may they transcend their healing to all those who have been affected with COVID-19. Últimamente, nomás quiero darles las gracias a la jueza, al alcalde Turner y a todos los elegidos de todo lo que estamos haciendo y el trabajo que se está llevando a cabo. Pero también quería reconocer que esta semana también, aparte de acudir los dineros necesarios para poner recurso médico, como indicó nuestra jueza, también llegamos a dar un voto de reconocimiento, de respeto, de agradecimiento a todos los trabajadores, los médicos, las enfermeras, todos que trabajan dentro del sistema, la industria de salud, porque nosotros sabemos que ustedes realmente son la línea frente en esta crisis, en este pandémico. Entonces, les queremos dar las gracias a ustedes. Y aparte de eso, les quiero dar las gracias a todos los ciudadanos de nuestra comunidad. Ustedes realmente han sido nuestros compañeros en ayudarnos a trabajar durante esta crisis en un modo mucho más fácil de lo que realmente uno esperaba. Pero porque ustedes están cumpliendo con las reglas, las órdenes, nosotros hemos tenido mucha más oportunidad para hacer todo lo que es necesario. Así que les doy las gracias a todos. Y últimamente, estamos en el fin de semana de la Pascua. Y les quiero suplicar a todos de, por favor, en el nombre que llaman su Dios, les suplico una oración para todo el mundo, para todo el país, para nuestra comunidad, en particularmente para todos que han sido afectados por este virus de corona. Y les quiero suplicar, por favor, que también lleguen a orar para todos los elegidos, todos los líderes, todos los médicos, para que podamos salir adelante de todo esto. Gracias a todos. Thank you, Judge. Thank you, ma'am.
I too would like to thank you, Judge. I want to thank you for your leadership, but I'd like to use an adjective that I think is appropriate. I want to thank you for your courageous leadership that you and Mayor Turner have shown. You've taken some positions that were tough, and I'm just proud to know that you have the courage to do the right thing. I'm the grandson of a preacher. I understand what it's like to worship, but I'm appreciative to all of those pastors who have said that they will worship, but they're going to consider the lives of others and the destiny and fate of our country as they worship. I'm the grandson of a preacher. I will worship, but I understand the times, and I understand what the times call for. So I thank you for your courage. Intestinal fortitude is needed in times such as these. I want to thank those people who sack groceries, bagging the groceries. And if I may just share this with you, Judge, Mayor, Commissioners. I was in a facility just before coming here, and I was disappointed to see that the workers didn't have on face gear. The workers didn't have on gloves. People coming in were not necessarily dressed as I'm dressed, prepared with this proper paraphernalia. And it hurt my heart to see those people having to work and not get the proper paraphernalia. So my hue and cry, my clarion call would be this. Business people, owners, this was a food store. Help your workers. Help your workers. Give them the paraphernalia they need. In this store, you could have gone through the store and found the necessary paraphernalia for a face. So I'm just going to say, I thank them. They're the unsung heroes, and I thank them. I'd like to mention this, Mayor and Judge. The federal government has to do more. I appreciate what we've done, but we need more mobile testing units. We need mobile testing units. We need more mobile testing units. We've got to know where the virus is so that we will know how to prepare even better and to take care of the people that we've all sworn an oath to support and take care of. We've got to know, and I promise you that fight for mobile testing units is on right now in Congress. And we're going to fight to get more mobile testing units. Very important. I close with this to my good friend, Commissioner Garcia, and my good friend, I like to say Senator Ellis, but Commissioner Ellis, I could say Councilmember Ellis, and to you, Mayor, and to you, Judge. This really is a team effort, and it has to be a team effort. It has to be a team effort. There is no other way to do this. It's about all of us, and we should all be working together to do what's necessary to protect the people, not only in our city, our county, our state, but the people in this country. This is what government is for. We dare fail now. We must succeed. So again, Judge, thank you for your courage. Mayor, thank you for the support. And I pray that all of those who are suffering will find some relief, because many have lost their lives and there are many families that are suffering. Thank you so much, Judge.
Thank you. Thank you. We'll take any questions.
Judge, we've been known to get some rain, obviously, in the area, and often get floods in the month of May. What is the contingency plan if these tents are necessary for that kind of storm, that kind of rain?
We're absolutely aware of the elements in our region. And so one is, of course, the heat. And so the tents are all climate controlled. And another is the rain. So they've been elevated and are protected against flooding. Now we're also working to clean out the inside of the NRG facilities so that as we expand, ideally we expand, if necessary, on the inside. The limiting factor there is ensuring that the air after the rodeo is as clean as it would be in a hospital. But the experts that build these facilities, that have them around the country, having this, the design, the precautions, given the weather, given the rain, it's adequate right now, and it takes into account the conditions we face in our county.
And with those rooms that you're talking about, if they were to move indoors, would that be in the center here or would it be in the stadium?
They would not be in the stadium. It would be, we're still assessing exactly where, but it would be here.
The other day you mentioned that there are roughly 250 ICU beds available in the area. Do you know if that number is changing, or how likely do you think it is that we're going to need to use this facility?
The likelihood is anybody's guess. The projections right now that we have show us peaking underneath the hospital capacity. So if we continue with our precautions, we have the ability to get out of this without a deeper crisis and recover a lot easier, not just our health, but also our economy. But those projections are all based on the assumption that people continue to stay home until we peak, and we have not peaked yet. And so to answer your question, how likely is it that we will exceed the hospital capacity? It depends on folks limiting contact with those who don't live in their home. And so that's why we are putting in the investment, the work, federal government, city, county, all of us, state, of course, but we need everybody to continue to do their part. Of course, the hospitals are planning on their surge capacity, and this would be if the hospitals are full, their surge is full, and then we still need additional beds.
There are some people at home that are going to look at this price and think it's too expensive. How do you respond to that?
Right now, I would rather say I did too much, and I understand that there's no winning in that sense. You know, if we do our job, people will say we did too much. People will say this was an additional cost we didn't have to incur. but I can sleep easy with that assessment. What I can't do is tolerate a scenario in which this has been going on overseas, this has been going on across our country, and yet we're caught flat-footed, and that means deaths. Right now, our death count already is too high, and the projections are frightening. Hundreds of thousands of deaths in this country if we don't each do our jobs. And so to me, it's not a question. Of course, I'd love to invest these funds on early childhood programs or flood control or transportation or what have you. But right now, what we have to do is protect human life, and we have to be smart. We know this is coming. We're the next domino to fall. The two counties that are larger than Harris County are in very dire straits. People are watching this community, and we're doing everything to show them that we can be smarter, and that ultimately, if you want to put dollars and cents, ultimately, that'll be better for all of us, because the cost of having an outbreak, losing lives, overwhelmed hospitals, the kind of thing we're seeing elsewhere, you can be sure that will cost more. But this is not about dollars and cents. It's about lives. It's about being smart. It's about being proactive. There's no guarantee that we succeed. We're just giving ourselves the best shot. And of course, we'll be reimbursed. You know, there's a partnership with the federal government, 75% reimbursement. The investment that we've all agreed is up to $60 million, but that would be reimbursed at a 75% rate, thanks to our federal partners and our state partners that have helped us advocate.
Judge, this question is for you and the mayor. The governor has talked about wanting to start the process of reopening the state. He's mentioned he wants to do that starting next week, possibly, at least start that process. Have you guys been in discussions with the governor about that, and what is your personal opinion?
Look, we're all having conversations and have been having conversations about once we get to the point where we can restart, what would that look like? And so that means we have to do the right projections, we have to have the right strategy. You know, probably you wouldn't lift everything all at once, you have to do certain portions. The limiting factor, though, to be able to get back to business as usual is two. First, we cannot responsibly go back to business as usual if our case count continues to rise linearly or exponentially. We have got to hit the peak first, and we have not hit our peak. We're still getting overnight. We've gotten 600, 1,000 cases. Today, almost 300. We are not at the point of peaking, so until you get to the worst case scenario, you can't let things back to normal and make it even worse. That's one. The second requirement is we have got to have enough testing, because if we get past the peak and we open back up, there's not just one peak, there's going to be another one, undoubtedly. We've seen it elsewhere. Folks come back out, someone's going to contract the virus. If we don't have enough testing to where anybody with symptoms can go get tested, get a result back quickly, isolate themselves and anyone they've come into contact with, and everybody else can go on with their lives, we're going to be right back where we were 3 weeks ago. We're going to open up, folks are going to come out, we're going to get sick again, everyone's going to get sick again, and we're going to have to shut everything back down again. And so if we want to be able to have a more surgical response, we've got to have more tests. So that's why this news from the federal government is great. We need a lot more. And of course, we all have to recognize those two things that have to happen before we can responsibly come back online. But all of us are having conversation about what would it look like. And so I respect and understand that those conversations are happening at the state level as well. Mayor Turner.
And I agree with the judge. We have to make sure we're doing everything we can to mitigate this healthcare crisis. And a part of that is testing. What we need now is more testing, because that's the only way you're going to measure the degree of the community spread. So that's critical. Number two, we need to make sure that we have all the necessary supplies, not just for now, but when you reopen, even down the fact. And number three, the judge and I have been talking several times about the strategic plan to move forward. So those conversations, in fact, we had this conversation on yesterday, at length. And again, I was texting each other this morning in terms of the strategic plan to move forward. So those conversations are taking place. and we recognize that as we move forward, what are going to be the determining factors? Because you have to look at your healthcare situation, and to the degree you've mitigated it, you have to listen to the medical professionals and the advice that they are giving to you, the facts, what's happening on the ground. And then you have to bear in mind that there are a lot of stakeholders that you have to involve in this conversation, both in the private, the nonprofit, and the public sector. So all of those things have to come into play. But we are having those conversations. I think, though, it would be premature to put that out front as if this whole situation has been contained and mitigated. I think you have to stay focused. There are still people, vulnerable populations, who don't know whether or not they have it or they don't have it. I mean, there are people who are already on the margins in our communities who want to be tested and may not have the ability to get to a testing site. So it's very, very important, and we owe it to these communities, especially that have been underserved, under-resourced, communities of color, and others. We still have people, for example, in our community, regardless of where they come from, whether they're documented or undocumented, that are still concerned as to whether or not if they step forward, the system will work against them. So we have a lot of work to do to mitigate the risk, to encourage people not to continue to proceed in social distancing, but at the same time, let me assure you and others that the judge and I are having these conversations, talking about what should be the strategic plan, who all should be included, such that when the time is right, we can move forward to reopen, and then it's not going to be you turn on the switch and the lights come on. It will have to be a very phased-in approach and done strategically in order for us to make sure that we are not being more hurtful in the recovery phase.
Mayor or Dr. Burns, can you expand a little bit on the increased testing capacity at these sites? I know just days ago we were worried, or you guys were worried that the federal system was going to be revoked to the 4 sites entirely. Now we're doubling capacity. How did that come to be?
What was the last part of that?
How did we get from the funds were threatening to pull out entirely to now they're doubling capacity?
Yeah, I think we really need to thank our congressional delegation and the governor and really all of our politicians, the mayor and the judge, who have got the word up to the federal government to understand the public health processes and and how it works. And as the mayor just pointed out and the judge has before, is that in order for us to have a good understanding of what is happening with the virus in the community, we have to get the testing done. So in the beginning, we were testing in order to identify those individuals who had the virus so we could get them to isolate and stop the spread. And now that we have a lot of community spread, we need to have a lot of testing. For that reason continues, so that people, if they're infected, they can isolate at home. But because this virus spreads in people who don't even have symptoms, all the more important that we identify folks who may be spreading without knowing it, and get an idea as to how far spread it is within the community. And then the other thing is, remember that this is occurring across a long period of time. And so some individuals who tested early, they may want to get tested again to find out whether they have contracted the virus since then. So this gets a little bit more complicated, and I think the federal government has finally kind of understood that and said, oh my gosh, you're right. So we need it. So I think that was the change of course. And it really has to do with the people up here, these folks behind me, and their colleagues who caused that change to occur.
The judge said a little over 8,000 tests at the county site so far. Do you know how many the city?
So the city's at about, we're over 6,000. Yeah.
One last question back here.
How are you prioritizing the real-time tests? And how is Harris County and the city of Houston really trying to push for us to get that?
We get word every day from folks, 15-minute blood tests, real-time tests. We've been running all of those ideas and options down. We have a team at the Office of Emergency Management dedicated to running that down. So far, the challenges have been we haven't received tests that can do that at scale and quickly. There's some that say we have it, but it's going to come, the machine comes in 8 weeks, or we have it, but we can only do a few. Now, the good news is it looks like these are quickly coming to scale. And so I think in a best case scenario, over the next 2-3 weeks, there will be more of this across the community from the private sector. Hopefully we are able to leverage some of that ourselves. And as I've said before, the projection and the best case scenario is that the public testings are not be the bulk of the testing options. We need the supply chains to catch up, and the supply chains are catching up, so that this is something that our entire community truly is fully on board with. There are already several efforts, but in order to have the volume that we need to be truly smart and surgical with our response once we're able to lift the order, is we're going to need a lot wider testing. Those real-time tests are very crucial, and it's just a matter of it all catching up so we have it at scale.
So when you have those real-time testing, how is that going to help you guys make better decisions?
So real-time testing or shorter turnaround, part of the challenge we've had is some of the tests have taken the results have taken many days to come back. And so in a week, up to a week sometimes to come back. And so what we are trying to aim for is something like what other countries have been able to do. You know, we get past the peak. Right now, everyone continues to stay home to isolate. We've built additional capacity for our hospitals with this shelter. In a perfect world, we hit the peak. We don't hit hospital capacity. We do better than all these other communities. We move on. Then it comes time to lift the order. At that point, we should be able to, in a perfect world, somebody has symptoms, they get tested, they quickly get the result, so they can quickly stay home before they contaminate or end up spreading the disease to other people. And that will allow us to be very surgical with the strategy. That way, only those people who we know are positive and the folks they've come into close contact with are the ones they have to isolate, as opposed to asking the entire community to isolate, which is what we're having to do right now, just because we know for a fact that there's many more people who have the virus who've not yet been diagnosed. And so to the extent that the test results have a quick turnaround, then that system would work. So that's why it's so important. Sí, las pruebas cuyos resultados recibimos rápidamente serían una gran ayuda. En este momento estamos teniendo que esperar días, inclusive una semana, para recibir resultados de las pruebas. Eso es un problema porque en un futuro en el que queramos tener una respuesta un poco más detallada, vamos a necesitar pruebas con resultados rápidos. En un mundo perfecto, ideal, así funcionaría la cosa. Lograríamos pasar el punto máximo de los casos, lograríamos, gracias a los esfuerzos de todos, de quedarse en casa, y llegaríamos al momento de levantar la orden. Cuando lleguemos a ese momento, si tenemos suficientes pruebas, si tenemos pruebas rápidas, vamos a poder identificar cualquier persona que se sienta enferma, se hace la prueba, rápidamente recibe el resultado y si es positivo, esa persona se queda en casa y las personas con quien han estado en contacto, no más. El resto de nosotros podemos seguir con nuestras vidas. En este momento tenemos que aislarnos todos, simplemente porque sabemos que hay muchas más personas en la comunidad que tienen el virus, pero no lo saben. Entonces, el poder responder de una manera mucho más detallada, en lugar de tener que volver a cerrar todo, realmente depende de nuestra habilidad de tener muchísimas más pruebas y pruebas que regresen los resultados rápidamente. Las buenas noticias es que todavía obviamente no podemos levantar la orden porque los casos van de subida, no hemos llegado al tope aún. Y en este tiempo están alcanzando a producir más y más pruebas, incluyendo pruebas rápidas. Entonces, esperamos que en un par de semanas ya tengamos más pruebas y al momento que llegue de levantar la orden, tengamos la habilidad de tener esta respuesta más detallada y no tener que volver a cerrar todo en cuanto surjan casos. Our best estimates of when we'll hit the peak of this crisis is end of this month, perhaps early next month. As I've said many times, though, those projections depend on or rely on the assumption that the current trends will continue. And the current trends are people staying home and away from people they don't live with. And so if folks begin to go out and spend time with folks they don't live with, then the peak will come later and it will be higher. And we may overwhelm the healthcare system and it will take us longer to get out of this and to be able to get the economy back on track. Yes.
The numbers just came in for the city of Houston, and today we're adding 61 61 new cases, which will bring our total to 2,124. So 61 new cases, and then pleased to announce no deaths for today, 0 deaths. So
Thank you all so much. Thank you.
Oh, blood test? That's good to tell you if you've had it, not if you've had it.
All right, city and county leaders there from NRG Park updating us today on the new medical shelter that has been under construction for the last week or so. Will be available for use tomorrow. We don't think it'll be activated then, but it's there to go initially with 250 beds. This will be overflow for hospitals in our area in case they are overwhelmed at some point with COVID-19 patients. These are medical tents. They are climate controlled. They are elevated. They have doctors and nurses and everything they need to get going. The county hired a contractor, put this in place. Right now they're at $11 million to build this over at NRG, with 75% of that being paid by FEMA, the federal government. So it looks like the county right now is on the hook for about $2.5 million on this, but potentially $60 million total if this facility is needed, activated, and has to expand to full capacity, which will be 2,000 beds over at NRG Park. And that is what the city and county are talking about today, what they toured. We were able to get in there and get a look at that as well, since it has not been opened yet, and we'll have that for you coming up later today when our local newscast airs. So a couple new things as well. The mayor says he has been watching the parks, drove through a few of them and noticed that most people are complying, he says, with his order to shut down city parks. County parks also closed in Harris County through the Easter weekend to maintain social distancing. Looks like our peak not here yet. The judge estimating that'll come sometime here in the next couple of weeks, 2 to 3 weeks. So that's the news here from our city and local leaders over at NRG Park. Just wanted to get you up to speed on that medical shelter that has been constructed and now is ready to go. Want to let you know tonight, coming up here at 5:30, we hope you'll watch the CBS Evening News at 5:30. That's the newscast for the entire country, anchored by our own Mia Gradney from right here at the KHOU studios. And then I'll have the local news for you coming up tonight at 6 o'clock. As always, you can stay connected there with the KHOU mobile app. Download that and turn on those push notifications. We'll get in touch anytime one of these live updates is coming your way, so you can tune in and be ready to go. I'm Russ Lewis in the KHOU newsroom. We will see you for the CBS Evening News from Houston at 5:30.